Hi, this is Dr. Jason West, and welcome to New Frontiers for Health. This is part 2 of our Lyme disease presentation that we gave at the Utah Lyme Disease Conference in early 2011. I'm an alternative medical practitioner that practices in Pocatello, Idaho. We've developed some really nice treatment protocols for Lyme disease, and we wanted to review those in the presentation. Let's get started. As we left off, Lyme disease is a cyclic disease which has a chronic, multisystemic neuropsychiatric manifestations. And I love this graphic right here because it shows Lyme disease, how it can affect your mind, how it can affect your liver, your organs, and your intestinal tract. I find that Lyme disease really likes to bother the stomach and causes a lot of neurotransmitter problems in the stomach that cause a lot of neurologic problems. There's a really interesting book called The Second Brain, which talks about how an impact of the neurotransmitters in your stomach affects your emotions, your moods, can cause cyclic mood disorders, etc. And I find that to be a case in a lot of Lyme disease cases. They have a lot of stomach problems. So Lyme disease also attacks the nervous system, and particularly the brain. It changes the structure of the brain and alters almost every organ system of the body. This is cyclic mood disorders and Lyme disease. The neuropsychiatric components of chronic infections ends as marriages, friendships, jobs, and promotes addiction, aggressive, and character disorders. And if you talk to any family members of someone that had chronic Lyme disease, you'll notice that frequently they'll say their personality has changed, what they like has changed, they're aggressive, addictive. ABC News actually identified something called Lyme's rage, and they said that nearly 20,000 people are infected and treated every year, but countless others go undiagnosed. And in the co-infection stage of Lyme disease, there's something called Bartonellosis, which may include encephalitis or swelling of the brain, headaches, major memory loss, rages, seizures and coma, as well as inflammation of the heart, abdominal pain, bone lesions, and loss of vision. So the causes of Lyme disease is a bacteria called Borrelia burgdorferi, which is transmitted to humans through the bite of an insect vector. And in traditional medicine, we always believe that that is a tick. Ixodes scapularis is the tick that's been identified, but more and more doctors are believing that any insect vector can transmit Lyme disease. So this is a black-legged tick nymph. You can see how small that is on someone's fingernail. I frequently see a lot of severe Lyme disease with spiders, and this is my own personal experience. It seems that as the Lyme disease is transmitted through spiders, there are neurotoxins injected into the body, and it seems to be more severe initially. So the transmission occurs through the bite of ticks. Though fewer 50% of patients with Lyme disease recall a tick bite, it's also important to rule in, rule out if there's been other insect vectors, a spider bite, or another type of a bite. In some studies, Lyme disease, the number is as low as 15% of people that have actually been bit or remember being bit. Lyme disease is a cousin to another bacteria called syphilis, a bacteria, spirochete, that causes syphilis. And there's a couple different stages of syphilis, which there's some correlation here. The primary stages of syphilis is you get a painless sore. The secondary stage is a rash on the body. The latent stage, or the quiet stage, which is the infectious stage, well, not a lot is happening. And the tertiary stage of syphilis can damage almost any part of the body. Lyme disease causes usually a rash, but it also can cause abnormalities in the skin, joint, heart, and nervous system. Can cause some unusual swelling in the joints. See a lot of unilateral swelling where one person's knee or one person's elbow will be swollen and the other won't, and then there's a significant amount of brain problems in some cases of Lyme disease. So we call it the great imitator. It can masquerade as a temperature deficit disorder, chronic fatigue syndrome, fibromyalgia, obsessive compulsive disorder, also Alzheimer's, schizophrenia, depression, multiple sclerosis. There was a recent study on how many people that have multiple sclerosis can have Lyme disease, arthritis, heart conditions. Two studies that are really significant. I love this study. It's out of the British Journal of Medical Practitioners. on the role of chronic bacterial viral infections in neurodegenerative, neurobehavioral, psychiatric, autoimmune, and fatiguing illness. So chronic illness, fatigue, and autoimmune disorders, it's important to rule in, rule out if there's some Lyme disease that's occurring. The history of Lyme disease, it was named after where it was discovered in Lyme, Connecticut in 1975 by a Dr. Steele that found juvenile cases of arthritis in the Connecticut and named it Lyme disease. In 1985, the Lyme disease became reportable in Minnesota. And before 1975, there are many opinions, possibly undiagnosed or misdiagnosed. Recent research on PubMed by Dr. Kurtenbach suggested it goes back thousands of years, at least through 1952. And there's a bunch of conspiracy theory that there was maybe something involving Plum Island and its proximity to Lyme, Connecticut. So again, it's recent history. In PubMed, the bacterium that causes Lyme disease, the fastest growing vector-borne disease in North America, actually originated in Europe before the Ice Age, says a new research coming out of the University of Bath in England. Interesting thought process on did Lyme disease change the course of history. This is Napoleon, and there was an article or some news out of Discovery Network. Napoleon's army brought down by bugs. It doesn't necessarily identify Lyme disease. However, in 2006, it's the bugs, the vector-borne illness displayed a key role in Napoleon Bonaparte's disastrous invasion of Russia in 1812, according to genetic research. I've heard a lot of different hypotheses on exactly what this is, but in essence, Napoleon's army marched into Russia in 1812 with the largest army Europe has ever seen, some 6 million soldiers, and 6 months later was reduced to a fraction of that. 25,000 men retreated to Vilnius, Lithuania in the freezing cold. Only 3,000 survived the war, weather, and disease, and the dead were buried in mass graves. Overall, nearly 1/3 of Napoleon's soldiers buried in Vilnius were affected by a vector-borne infectious disease, the researchers concluded. So that's part